Yeah, that is a really good question. And it's one that a lot of people ask because no one really knows what it is. What it actually is a procedure to augment the vertebral body. So, for example, if you've got osteoporosis and you've got a fracture, there are a number of ways we can sort of bulk up the vertebral body to stop it being painful and stop it fracturing again. And balloon kyphoplasty is one of those procedures. And it gets its name from the use of a balloon, a bit like an angioplasty. A lot of people have heard of coronary angioplasty, where you pop a little catheter into the vessels of the heart and you inflate a balloon to widen the blood vessel. And what happened was, back in the late 80s, some American surgeons figured out that you could use this technique in the vertebral bodies. So what I do, and I was one of the very early adopters in this country of this technique way back in sort of 2006, 2007. And what you do is you set up, you have these little working portals, these cannulas that you put into the vertebra in front from behind. It's all done under general anesthetic, of course, through minimal incisions. And you pop the balloons into the vertebra and you inflate the balloons a bit like, a builder might do with a house that's subsiding. The balloons push up and correct the end plate compression and create space in the vertebra. We take the balloon out and then we insert some special bone cement, which fixes the vertebra in situ and stops it being painful. And it's a really great technique. Yeah. Well, there's generally two groups of patients I see for balloon kyphoplasty. The first is a more elderly group of patients who have osteoporosis and can get a fracture from just very low energy trivial activity, from a simple fall from a standing height, or being knocked over by a dog or a car door, or even lifting one of their grandchildren or lifting something heavy. And the truth is, probably 90% of people who have an osteoporotic fracture get better within about 6 to 12 weeks, but 10% don't. And of those 10%, they get awful chronic pain, which is really debilitating. And it's important for people in primary care and people who refer to me and patients themselves to seek help from a specialist in that situation, because 86% of those patients can get better with a balloon kyphoplasty. And it's done virtually as a day case procedure in their home the next day, even if they need to stay overnight. The second group of patients is a younger group of patients. Probably I treat quite a few professional jockeys who have nasty falls. And again, they can get compression fractures of the vertebral body. And if we do a balloon kyphoplasty for them, if they're not getting better quickly enough, they can get back on the racetrack and become championship winning jockeys once more. It's a reasonably safe procedure, and the results are good. So we can extend it to that group of younger patients if they've got a painful traumatic fracture that's not improving. Yeah. Well, we touched a bit on what's involved in a balloon kyphoplasty already. I mean, in some respects, any spinal surgery is classified as major surgery, to be fair, because there can be serious side effects from any kind of spinal surgery. It does require mainly general anesthesia. The anesthetic for balloon kyphoplasty is very light. And in fact, for people who are quite unwell, we've even done it under local anesthetic. So it's a minimal access procedure, and it's generally really well tolerated. And as I was explaining, we pop some working portals, some tiny working portals, little tubes into the vertebra from the back through two tiny incisions, which heal up very quickly. And we can work through those to put the balloons into the vertebral body, which we can then inflate to fix the fracture. We take the balloons out, and then we put some special bone cement in, which stabilizes it in the long term. And the cement sets within 10 minutes. So by the time the patient's back on the ward, it's already set. And some people feel the benefit immediately as soon as they get up and walk around in the hospital, which is great to see because they get a fantastic result and they're delighted immediately. But for others, it takes a couple of weeks to see the benefit, because obviously we've done an operation and sometimes it can be a little bit sore afterwards. But when people do well, it's one of the most rewarding operations to do, actually. So it's great. It doesn't take long. Patients, if say, for example, someone's operation is early in the morning, they'll probably be going home the same evening from their light general anesthetic. And we see them a few days afterwards to check that they're healing up okay. And to be honest, they're home and they're doing their activities of daily living. They're back on their feet straight away. And some feel the fracture is much more stable immediately. And although they've got a bit of post-op pain, they're actually really delighted early on. For others, it takes up to 6 weeks to see the full benefit, and they're a little bit slower to recover. But generally, people, they don't need any special nursing care or anything when they go home. They can just do their take it easy for a couple of weeks, do their normal activities of daily living. Once they come back and see me at 2 weeks, then they're generally better. Yeah, well, there's always risk with any kind of spinal surgery, but again, balloon kyphoplasty is probably one of the safer operations that we do that has a really good side effect profile. I've done hundreds of them now, and we always audit our results, but things like infection or bleeding are incredibly rare. And sometimes you get a little bit of cement leakage, but generally that is a very small volume because we only use small volumes of cement. We're looking at one or 2 milliliters of cement through each portal generally for most surgeries. And the chance of that causing any symptoms is something like 0.03%. So it's incredibly rare. But like all surgery, people need to be properly informed about it and take an informed decision about whether or not it's for them.